There it is. All right. Good afternoon. I'm Kylie Rodriguez. I am the benefits manager here at the consortium. This is our last class or session in our education session series this year. We appreciate all of our municipalities who have hopped on and learned about the consortium, learned about policies, learned about our plans, and learned about some other programs that we have to offer our members. Last month, we talked all about Canna RX. If you missed it, it is up on our website under the education session section under employer. I really encourage you to check out those recordings and those slide decks. There's lots of great information there. Today, we're going to be talking about ESI EAP. Some of our municipalities may already offer this service. A majority do not. It is a benefit outside of the health insurance, and we just want to make sure that all of our members are aware of the great services they have to offer at a really great rate, as Sean was saying earlier, thanks to the size of the consortium and those group rates we were able to get from them. So without further ado, I'd like to turn it over to Sean and Karen to talk about ESI EAP.
Thank you very much, Kylie. Let me go ahead and share my screen here with you. And if you could just let me know if you see that. Should say ESI Employee Assistance.
Yep, looks great.
Clear. Thank you.
All right, great. Thank you. So thank you very much. And good afternoon, everyone. Thanks for taking the time for joining me for this conversation today. My name's Sean Rafferty, and I'm with ESI EAP, and I'm joined today by my colleague, Karen Keiss, who is our Client Services Manager.
Good afternoon. Happy to be here.
So today, Karen and I want to make this pretty simple for you. I know you've attended quite a few of these benefits seminars, but what it really boils down to is we want to talk about what our EAP is, how members can use it when life gets a little complicated, and also how you can utilize it to help support your staff. I don't have to tell you all that municipal work is the kind of work that people notice when it stops, right? A missed shift, an unresolved conflict, serious incident, or one key employee functioning below capacity can quickly affect a whole department, and sometimes the residents who depend on it. So 18 of the 86 municipalities invited here today already partner with ESI. For those current members, I hope you hear at least a few practical ways to get more value from your program. And for the municipalities evaluating EAP services, I'm not asking you to think about another wellness perk. What I'm asking you to consider is whether your employees and supervisors have a reliable system for addressing human problems before they become operational problems. So that's the lens for today, really. Earlier support, stronger supervisors, and more continuity in public service. So let's begin by broadening our scope on what EAP can do. So when many people hear EAP, they think only of counseling after a crisis. And that definition really is too narrow. A modern EAP is an employer-sponsored support system for employees and eligible family members. It combines confidential counseling with coaching, legal and financial guidance, caregiving resources, referrals, training, self-help tools, and consultations for supervisors and HR. So the oops, that wasn't supposed to move like that. So the practical value is that an employee does not need a diagnosis, right? And the problem does not need to be severe. A person can call our EAP about stress, grief, debt, family issue, a difficult transition, or simply not knowing where to begin. So for the 18 current member municipalities, these resources are available now, and for prospective municipalities, this is the capability that you are evaluating. One accessible front door for a wide range of issues that otherwise consume employee time and management time. So we at ESI have been an EAP for over 35 years. We've helped thousands of employees and hundreds of employers to face challenges both work and at home. And we've grown by listening to our clients and members and paying attention to what is going on in their lives, in the workplace, and then at the world at large, and then providing solutions to address those evolving challenges. Here's a little bit of information to show you what the current workforce looks like out there and why there is a need for EAP. The statistics on this slide establish the broad direction, but the municipal version of the story is even more specific. Public employees are working through vacancies, overtime, difficult resident interactions, emergency response for like fire departments and public safety, aging infrastructures, budget limits, etc. Current public sector research continues to identify workload and burnout as leading drivers for workforce mental health concerns. And sometimes that pressure appears as what? As absenteeism. It appears as presenteeism. The employee is at work but tired, distracted, or irritable. And an EAP can't repair understaffing or compensation or unsafe work design. Its role is narrower and more credible. It provides earlier help for the human factors that can amplify the attendance, the conflict, the performance, and the retention problems. And just piggybacking on that, these are the big challenges every organization sees. Training, productivity, engagement, and retention are not four separate issues. In municipal operations, as you know, they form a chain. When an experienced employee leaves, the municipality loses headcount, institutional knowledge, licenses, local relationships, and often the person who was training everybody else. The vacancy increases workload and overtime, and that strain can lower engagement and increase the chance that another employee leaves. So our focus here at ESI EAP is to deliver human-centered, unparalleled support and care. Can an employee reach a qualified human being quickly, especially outside normal business hours? Does the program address the real range of issues affecting employees and families, or only a narrow clinical category? And third, does the EAP help the organization create awareness, support supervisors, and demonstrate that people are actually engaging with the program? These are all things that we prioritize at ESI EAP. And what we mean by human-centered care, more benefits and solutions and measurable results are the objective is not to build the largest menu of features and throw them all at you. It's to make the right help easier to reach and easier to use for your folks. And we do that by boosting productivity and engagement with tools and services to address just a few examples: personal problems and distractions, work-life balance, health, wellness, and well-being, and training and development. And this here is everything that ESI EAP is about. Think of Total Care EAP as one system with multiple doors, okay? One employee may need in-the-moment counseling. Another may need elder care referrals. A dispatcher may prefer a digital self-guided tool and go on and use our self-help resources. Maybe a brand new supervisor may need professional coaching from us. And
Curtis,
also,
you come here.
HR may need consultation before addressing a deteriorating performance issue. The value is not that every employee uses every service, but the value is that the program can meet people at different levels, at their level of need, without forcing every problem through the same channel. And for a municipality, that creates a more coherent response than asking employees and supervisors to search separately for a counselor over here, an attorney over here, call your financial resources over there. We need to find some type of training vendors for this, and we need to find caregiver locators as well too. And then also crisis support, like a trauma response that we provide. We provide all of that at one phenomenal group discounted rate through Municipal Health Insurance Consortium. We provide more EAP benefits and service. Our utilization by far surpasses most EAPs that are available out there in this country, probably other countries as well too. And you can see by the chart there, the higher productivity and higher satisfaction that comes from Total Care EAP, because we have the mechanisms in place throughout our entire communication path with your employees to monitor and make sure we are performing and hitting our measurable results. We are constantly measuring all of our performance at every level and improving on them. So who's covered? That's a great question, because it's not just your employee or yourself. It's a household coverage, and it's one of the quiet reasons why EAP can have really outsized workforce value. And for participating municipalities, coverage extends beyond the employee and includes people living in the employee's household, as well as dependent children up to age 26 who might live elsewhere. Because this is really important. As you know, household problems often become workforce problems. A spouse's stress, a child's mental health concern, an aging parent's needs, a conflict of home of any nature can just snowball into productivity and absentee and presentee issues in the workplace. Another really important aspect of all of our services is confidentiality. And it's not just a technical feature, it's what turns an available benefit into an actual usable benefit. Voluntary counseling contacts and voluntary counseling contacts and clinical records, are not shared with the municipality, supervisors, coworkers, or even family members. However, there are legal exceptions when a situation comes to threats of harm to self or abuse of a child or elder or persons with disabilities. So the legal reasons why we might have to report that. So telephonic counseling at 2 a.m. after a difficult call, during a storm response, or before a supervisor begins a sensitive conversation, access really, truly matters. Employee and eligible family members can call 24 hours a day, 7 days a week, and speak directly with an experienced master's or doctoral level clinician. The average speed to a counselor shown here is 11 seconds, and there's no limit on calls for in-the-moment support. So our counselors listen, they check for immediate safety when appropriate, they clarify the concern, they help the caller build an individualized next step because they are solution focused. And that may involve support during the call or practical information, referral, or ongoing counseling. I really wanted to include this slide here because it's absolutely symbolizes what we are all about here at ESI EAP, because we know people don't experience an EAP as a brochure or a contract, right? They experience it as a conversation. We care means the concern is treated seriously, whether it involves grief, anxiety, a family problem, finances. We are responsive means the member receives a clear next step rather than being passed from place to place or having to call and press for and hope for the best. We have staff ready to help means support is available for routine needs and unexpected events. So a referral without follow-through is not a complete service experience, and ESI uses several touch points after a member receives a referral. An immediate survey, check-in calls when appropriate, confirmation that resources were provided, a 2-week follow-up, and a later provider satisfaction survey. And so the purpose is not to create administrative burden. It's to reduce the chance that someone receives a name or phone number and then gets lost in scheduling or availability or uncertainty about what to do next. So that can be especially important in rural areas and for employees working non-traditional schedules. So this slide here, the goal essentially is to match the member with the most appropriate form of care based on their need, their location, their schedule, their preference, and provider ability. So options can include in-person counseling, telehealth, text, voice, video, and under the plan that you have with MHIC, employees and eligible family members receive 3 free counseling sessions per life event per contract year with no copay for those covered EAP sessions. So remember, even if you call the EAP, receiving support during the call and asking questions, or you use our website, it doesn't automatically take up a free counseling session. That's important to remember because employees shouldn't hesitate to call out of fear they're using up the benefit. As part of your membership with ESI EAP, we provide an amazing app free of charge, and that would normally be $29.99 a month in the App Store or the Google Play Store. Talkspace Go provides a low friction way to begin. It's private, and the member can visit it on their own schedule. They don't have to call anybody. They can just get on this app and get really amazing comprehensive services. It's a self-guided mental health well-being app available to eligible members and family members ages 13 and older. So it's designed for short, practical engagement, most often 5 minutes at a time, and it's got over 400 interactive programs. They have classes, therapist-led anonymous group classes almost every other night during the summer here. And we post those right on the front of our homepage, and you can participate in those. And I personally love those way more than recorded webinars because I feel like I'm interacting and I'm able to kind of stay present through the session. And they do an amazing job with their professionals over there at Talkspace Go. We also have a really great free legal benefit that is there to help you with wills, traffic violations, divorce, custody, and more. There's no charge for your initial phone consultation up to 30 minutes. And then if you hire that attorney, the billable hourly rate is discounted by 25%. We also have child and elder care benefit, where this generation now is becoming more and more known as the sandwich generation, where they are not only taking care of their children, but they're also having to take care of and find resources and support for the elder family members as well too. The website also includes locators, articles, and decision support tools. It's not simply an employee convenience. In a small department, one unresolved care problem can create recurring call-offs or late arrivals or distraction for weeks. And so giving the employee a credible starting point to handle these types of issues can reduce their search time and help that family make decisions sooner. It doesn't necessarily eliminate the care problem, but it can shorten the search and reduce repeated last-minute disruptions. On top of that, we also offer a couple specialized services for adoption and children with disabilities. We offer a really great resource called the Personal Research Assistant. I call it my personal concierge because I'm on there all the time asking them to look up things for me. I had them looking up doggy daycare for me when I had to go on vacation recently. So it literally is like your own concierge service where you call our same 800 number and the personal research assistant will help do the legwork for you and find you support groups or summer camp options or scholarships. And then they'll get back to you with that information based on your location and the types of things you need. Again, the whole point is to be able to free people up so that they can be more productive at work and free their time up and not have to do this searching while they're in the office or at their work laptop. We also offer certified financial coaching free of charge, does not count towards your 3 free counseling sessions per life issue per year. This helps members create practical plans around debt, credit savings, spending, home purchasing, and student debt. So it's one-on-one coaching, and it's supported by more than 200 tutorials in the Personal Finance and Education Center. We also offer peak performance coaching these are just a few of the areas that we focus on, but I think there's like 18 different topics that we help your employees with. And the coaching's goal-oriented. The coach helps the member define the starting point, establish practical actions for them, and then maintain accountability so that they can accomplish that goal as well too. And municipal applications are easy to see here. Say you have a new foreperson learning to give clear feedback, right? Or an employee preparing for retirement, or a department head managing conflict between experienced staff, or an employee trying to rebuild routines after a really difficult period. The coaching can reinforce training by helping the member apply those concepts into real life situations. And comparable private coaching can be extremely expensive if you ever priced it out. And through this EAP, eligible coaching is included, and again, confidential. Another wonderful resource we have for you as part of your EAP is our training and development. And as you all know, training capacity is a recurring municipal constraint, right? The need is broad, the budget's limited, and the workforce may be spread across departments and locations and shifts. So what we do at Total Care EAP is include thousands of online courses for personal and professional development for you, with new content added frequently and regularly. Employees can use courses independently, or you can have supervisors assign certain trainings as well too. And then during the professional coaching, they can even help reinforce those applications. So the library can also support your onboarding, supervisor development, communications. We have hundreds of our clients in New York State utilize the New York State sexual harassment training that we have provided free of charge as well too. So if you're paying for somebody to do that for you now, I would highly consider doing it through our EAP. And we have attorneys always constantly making sure that it is up to date and current, and that all the information that New York State requires is in the training at all times. The lifestyle savings benefit, my personal favorite. I imagine, like me, you all like to save a few bucks. Well, this can really save you more than a few bucks on health and wellness, auto purchasing, coupons, discounts, gift cards of all sorts, theme parks, flights, rental car. I highly advise, if you are a current EAP member now, go on to the lifestyle savings benefit. If you're thinking on making any kind of significant purchase or vacation plans, go through that service first. And I assure you, you'll find at the very least 10%, sometimes upwards of 50 and 60% discounts on things. It just depends on what you're looking for at that particular time. But again, we offer all these benefits through one doorway into our website, and then your employees can discover the higher impact services, such as the self-help resources we have available on our website. So the self-help resources create a private first step for employees who are not ready to pick up the phone and call us, right? They can not only access all of these services, but they can also do an online EAP intake because some folks just aren't comfortable with the phone call, and that's fine. We provide them that easy access to do online as well too, in addition to picking up the phone. But if someone needs in the moment counseling support, which we provide, the second they pick up that phone, you are dealing with a credentialed, experienced clinician. If they need that in the moment support, call the 800 number. That's the fastest way to get support. This is just a little bit of a view of our website where it provides, you'll see up at the top right, your orientation video, 5 minutes overview that really sums it up really well. I would highly recommend that to everybody. Your EAP intake form, your coaching, and your Talkspace Go class schedules and information. You see your training center, your lifestyle savings benefit, and your supervisor resource center. All really easy to access and all unbelievably comprehensive, the amount of information that's available there. We also have our website is entirely available through a mobile app available on the App Store or on the Google Play Store. You can scan that QR code right there and it'll take you right to it. And you could also search by using ESI Employee Assistance. Another great benefit that I think sometimes isn't in the forefront because it's not something we typically lead with, but is unbelievably important because a lot of other EAP services and other wellness type benefits charge for these services, but we offer free education and promotion with your digital communication systems so that we can keep your members engaged and interacting with them so that that bar for the stigma is even lower so that hopefully they'll contact us when there are need or have an issue that they'd like to discuss. Because once a benefit announced once by email will not really remain visible to a workforce. That includes like highway crews and police and fire, right? We need to have a system in place that is not an accessory to the program. It's part of the program. And that's exactly what we do here by providing you with the brochures, the posters to put up in your break rooms or restrooms, email campaigns, monthly newsletters, and frequent leadership campaigns as well too. We provide live EAP overviews where, say, you decide you want to join us in the EAP, we set up a time, we get all of your folks together on a live EAP overview. We go A to Z, everything they have available to them. If somebody can't make it, we record it, we post it on your intranet site or somewhere that will be visible. And if you have folks that aren't typically getting hard copy materials, we provide them digital links as well too. So again, the goal is to provide as much access and visibility as possible because the EAP is only as good as its awareness. So we just went through all that, and we didn't even really discuss all the wealth of HR and management services that we have available to you as well. The EAP is not only an employee benefit, it is 50% a management resource as well too. And employees and family members receive confidential support, and HR department heads and supervisors receive consultation, referral tools, training, critical incident resources, and practical guidance when a people issue becomes complicated. So that matters in your municipalities where HR capacity could be limited. Supervisors wear several different roles, and frontline leaders may have deep technical experience, but maybe little formal preparation in performance conversations or conflict resolution, documentation, or other employee support type issues. Here you are. So the best time to seek consultation is before the difficult conversation, right? Not after it has gone badly. If you're a supervisor or HR leader or in leadership, um, you can call the EAP and consult with a senior counselor or certified HR professional. We have SHRM certified folks at our calling center, and you can discuss sudden behavior changes that you notice that you're not quite sure about, recurring conflicts, an employee maybe who appears just overwhelmed, um, what type of language to use when you're referring the employee to the EAP, boundaries, documentations, or how to approach a sensitive concern. This EAP is as much for your staff as it is for you in your leadership and supervisor role. The consultant will help the leader organize observable facts, separate the performance from diagnosis, right? We don't want to diagnose. We consider safety and determine an appropriate next step. So the municipality retains all decision-making authority in this situation, and the consultation doesn't replace legal advice, labor relations responsibilities, or established policy. But what this can do is this could feel like expanding the team without adding headcount, right? There's another qualified resource available to you when the issue's really important, possibly unfamiliar, or it might be emotionally charged as well too, and you're just not quite sure how to handle it. You call the same 800 number and you give us a call, and we help you walk through that situation. So one of those situations we call an administrative referral, which is it's a formal process to address policy violations and unacceptable job performance. So it's designed for a valued employee, right, with documented unacceptable performance or a policy violation, when the municipality is seeking improvement from them and when you'd prefer to retain the person. You like this person, they're a hard worker, they're valuable to your workforce, but boy, you've just been having these unacceptable performance issues and you can't quite get through to this person. Bingo, that's exactly when you call the EAP, and that's when you do an administrative referral. So you continue to manage the expectations and documentation, the discipline, the leave or labor relations or anything like that. We focus on assessment and appropriate response, which may include counseling, coaching, training, or referral. And with the employee's written authorization, the EAP could provide limited confirmation of participation and completion. And in those situations, one of the exceptions to the confidentiality, because again, you're working with us on behalf of that employee to make sure, let's get them back in action. We like them, we want them here as part of our workforce, and it documents it, and it shows that you're doing your due diligence to try to help this employee. Okay, I talked a little bit too much on that one. Sorry about that. I really firmly believe in the positive benefits of an administrative referral. Trauma response, you all also get one trauma response service with the EAP package that you have through MHIC. Trauma response counselor is available to address catastrophic workplace events. God forbid, there might be a fatality or severe injury, some type of violence or a natural disaster. And in the hours after an event like that, leaders are often managing operations, you're managing communications, you're managing safety. And then at the same time, you're trying to manage those human reactions at the same time, right? So ESI provides access to specialists in grief and trauma and critical incident stress management. And depending on the situation, support may include immediate leadership consultation, telephonic counseling as well too, and individual support. So we can come out, we can sit with the group, our experts talk through the situation, and then they can be available there afterwards for one-on-one or individual support if the people need that. We do these all the time, and unfortunately, I think it's an underutilized resource. And I'd have to say it's probably one of our most valuable resources that we have free of charge. This is just a little bit more information about what our Supervisor Resource Center has available to you. Brings together orientation materials. You have workforce management tools. You have engagement resources, FMLA resources, harassment and discrimination information. This is especially useful for first-line municipal supervisors who are promoted because they're excellent operators, technicians, or officers, but they haven't yet had extensive people management development. This Supervisor Resource Center is incredibly valuable to them, and it helps the supervisor prepare when the issue is complex or maybe high risk or emotionally charged. Again, the better next step is still always a live consultation as well. So always, please err on the side of giving us a call to help you work through that situation. We also help with the compliance training, coaching and training for manager and supervisor development, drug-free workplace and DOT compliance resources, and we provide a Better Together EAP partner bulletin. So to recap, this is our wonderful chart that we love so much that shows you the breadth of services and benefits that we have here at ESI. And so think of this program as 4 connected systems, right? We have the employee support, which includes immediate clinical help, counseling options, coaching, and self-help resources. Then we have family support too, legal, financial, caregiving, adoption. Third, we have management support, consultation, administrative referrals, trauma response, supervisor tools, and on top of that, workforce development as well too. A training library that includes over 10,000 different training modules, curated professional development learning paths for you that we've already vetted for you to make it that much easier. So the strategic value is earlier, more appropriate action. Employees receive help before a concern becomes a disruption, and then your supervisors receive guidance before they improvise. HR gains additional tools without surrendering authority or confidentiality. And EAP is only one component of a workforce strategy, but it's a component that can touch every single department and every level of organization. So a couple really important bullet points for you here. This again is evidence of our experience of scale. We have, again, over 1.5 million members, over 3,000 different employer relationships. We work with hundreds of municipalities across New York State alone, and 18 of which are part of your consortium. And for every prospective municipality, the next step is really not to accept our claims or my claims at face value. You can test them against your current census, your workforce pressures, your current resources, and implementation requirements. We also offer a money-back guarantee. Guarantee is straightforward. If a municipality is dissatisfied during the first 6 months, ESI will refund the program fee, less direct network counseling costs. So that reduces your financial risk right off the bat. But the more important protection is disciplined implementation. So before launch, the municipality should identify its workforce priorities, right? Internal contact, your eligible population, your communication channels, your supervisor needs, and your reporting expectations as well too. And then after launch, the program should be reviewed rather than assumed to be working. And a guarantee shows confidence. So a communication plan, supervisor orientation, account management cadence, and utilization reviews are what create value, and we provide all of those. You'll receive monthly utilization reports showing you all of the activity that your employees and your workforce are engaging with. And then we suggest easy lift options for you to increase that utilization, increase engagement as well too. So with that, I'd like to welcome any questions you might have outside of, I could not see the chat, so I'm not sure if there are any there. Karen, how are we looking on the chat?
We have nothing quite yet in the chat, so I think it's great for us to open it up for questions now.
Sure thing. That was a lot of
I'm gonna,
information.
I'm gonna kick it off with a question I always get, so that way you could answer it for everyone on the call. The question I always get is, do the employees have to be members of the consortium's health insurance to have access to ESI EAP? And
You
the
want to
other
take that?
to to tag on to that, they also question, is that how they decide how many employees they're going to offer the coverage to?
Karen, would you like to answer that?
Sure, that's a great question. Thank you, Kylie, for presenting us with that. And as an employee assistance program, we offer this program to all employees, regardless of whether or not they are on the municipality's health insurance. It's a wonderful, service that we can offer, and we actually need to offer it to all employees. That is the structure of the EAP. So yes, we cover all employees regardless of their whether or not they're on the healthcare of the municipality. And again, the same aspect. We also include all family members of all employees. So, and so that again, when we, as Sean mentioned earlier, with the establishing this setup and working with you to onboard, those are the questions that we ask you. We do ask for a census with employee name, zip codes, because we do then build a network for the providers that we offer, or that we will contract with. We want to make sure that we have ample providers, counselors in the area where your employees reside. Very important to us.
Yes, and we to piggyback on that, we do have many clients who prefer to take the communication emails that we have, and they would distribute them to their workforce as well too. Sometimes they only, they might have just personal emails, or not everybody has a work email. So we work with you to accommodate you to what the best approach is. And again, it's not to give you more administrative work. It's to hopefully take that burden off of you by increasing the awareness as much as we possibly can, based on what your normal communication is with your folks. And then we do whatever we can, provide you as much resources as you need to make sure it's visible with your organization.
So in our municipality, we cover large groups. We have counties, we have cities, but we also cover a lot of smaller municipalities like towns, villages. And a lot of those smaller municipalities face like a minimum fee because they don't reach that tier level of having enough employees to offer the coverage to. Could you kind of explain the pricing that they would see no matter their size?
I'll take that, Sean. So yes, again, one of the benefits of this service is that we have a contract with the with your consortium, so that regardless of the size of the group, we have a per person or per employee per year rate that we offer. So it's, if you have a group of 5, it's the same per person per year rate as if you have 500 employees. So that, and we're also offering tiered pricing. So as we grow, again, Sean had mentioned we have 18 organizations currently with ESI. As we grow, the cost per person per year reduces. So that's the benefit of, again, continuing to bring more organizations on board. Your pricing will then be reduced. So that's what we can offer you. And we're happy to. I do see a question. I'm sorry, Kylie, did I answer that question entirely? Is that?
Yes, you answered my question. I do see a question in the chat.
Terrific. That's what I was going to move to. So thank you. We have, what is the cost for this service per employee, and can we select which employees we include? Sean, do you want the current rate that we're offering per employee per year is, can you share that?
Yes, it's 1819 per year.
Okay, $18.19 per employee per year. And that's
Correct.
including all of the services that we discussed today. The benefit of ESI EAP is that, again, all of our services are included. Other EAPs, and you might have them, but there's often additional charges for many of the services that they offer, but we are in one inclusive price. And Gary, we really again, as an EAP, we do need to offer this service to all of your employees. Now, I'm not sure if you're talking about maybe part-time or others, and we certainly can have that discussion off to the side. But if we do need to offer this service to all employees within an organization. But you do provide us with the census, so we will go with the census that you provide us.
Yeah. And in the case of part-time or volunteer, even, we have situations where we'll price them a 2 to 1. So they essentially count as like half of
Correct.
a full-time employee in that situation. But then again, since we have a negotiated rate already, that shouldn't be an issue. You determine the eligible employees on your end, and we just take your census and we make sure that we have your folks in our system when they need to call us and ask for services.
So thanks, Gary. Yes, for full-time, that would be the 1819. And then we could offer the part-time a 2 to 1 value.
Yeah, and I guess the only time that's going to come into it's going to really matter is when we renegotiate the MHIC contract, right, Karen?
Correct.
Yeah. So, um, yeah, good question though. Everybody on the call, please feel free to scan that QR code that's on the screen there. That's my contact information. You could feel free to reach me at. You can either call me or send me an email. And part-time includes board members. I saw that. Yeah.
Okay.
And I think every institution has a board member, correct? Every municipality has a board member in the consortium, Kylie?
Yes,
Yeah. Okay.
but that's
Yeah.
our board. So they're talking about their own board.
Okay.
Yeah.
Correct. Okay, I see. Gotcha. Yeah, and we can have these discussions off to the side if you'd like to talk a little bit more about your particular workforce, the challenges and the opportunities you see for the EAP there. And that's not to say you get there might be some additional services that you might need at your particular organization. We have a couple of the organizations that we already work with that are utilizing more than 3 free counseling sessions, and that's a different tier, pricing tier, but that's something we can accommodate too. If you would like to look at something like that as well too, and don't forget you have one free trauma response per contract year as well too, where we can come in and help your workforce through a traumatic event or a crisis or something of that nature. And the great thing is that your employees, once we get this set up, there's no additional work on their end. They're in. They don't have to. They don't have to sign up for our service. They don't have to have any household members sign up. Once we get it rolling on our end, they're all good to go. And then we also provide services 90 days out from the termination point of an employee as well too. Any other questions, Karen?
No, there's no other questions in the chat. Does anyone else have a question for us today?
Kylie, anything else?
I don't have any other questions. Mine were kind of leading in to make sure we were getting that information covered. So, no questions on my end, and I'm not seeing any questions in the chat. So, I do appreciate your time today, Karen and Sean. You're always a wealth of information. This program is amazing. It really does provide an all-encompassing service to our members. And I hope more of our municipal members look into it for their employees. And then shameless plug to our board members who are on here. We are doing our board education session on August 27th at 5 p.m. Virtually. You'll be getting your invitation soon, but just a heads up for that too. Thank you so much.
Thank you, everybody. Have a great day.
Take care.